All right, without further delay, I'm going to get going. Hello, welcome to our fireside chat with Interactive Digital Solutions, Allina Health, Enghouse Video, and ViTelNet. We are so glad that you're here today. This is our third installment of a series of webinars that you can check out online, where we have casual conversations with integrated partners, industry experts, and influencers about innovative ideas and solutions to empower tech communications. Today, we're discussing how Allina Health is redefining employee well-being through innovative care solutions. So some real quick housekeeping. Throughout this webinar, you are able to submit questions through the chat. We'll be monitoring those, and we'll save them towards the end to answer. We are recording this webinar, and that will be posted to the IDS website in the next few days. I am Valerie Collinsworth, Chief Marketing Officer at Interactive Digital Solutions, and I'm happy to be moderating this today. Let's jump in. I'd like to introduce our host and guests. Today, our host is Rob Solomon, Executive Vice President of Operations at Interactive Digital Solutions. He'll be speaking with Allina Health's Dr. Mary Beth Lardizabal, System Medical Director for the Center for Provider Wellbeing, Dr. Heidi Woodland-Liney, Navigation Manager, and Ann Seaton, Wellbeing Navigation Manager. We also have representatives from Enghouse Video and ViTelNet joining us today. The webinar will showcase how Allina Health, a forward-thinking and very innovative healthcare organization, partnered with IDS, ViTelNet, and Enghouse Video to address employee well-being challenges. So without delay, I say welcome, Dr. Lardizabal, Dr. Woodland-Liney, and Jeff, Mark, and Rob. Rob, I'll kick it over to you to get started.
Thank you, Valerie, and welcome everyone. It's great to have you with us today. Last year, Mark, Jeff, and I hosted a HIMSS webinar called Telehealth Enabled Custom Workflows. In that session, we shared how our three organizations collaborated to address a specific need for an unnamed health system. Now, almost a year later, we're reconnecting, this time with that health system, to hear their perspective on the program, how it all came together, and to take a look at the data to see how it's making a positive impact on the employees of Allina Health. So, without further ado, Dr. Woodland-Liney, Dr. Lardizabal, and Ann, let's jump in. Talk to us about how Allina Health is redefining employee well-being.
Maybe I could start off, if you don't mind. I just think maybe it's important for your audience to know who Allina Health is, because as you said, a year ago we were unnamed, and now here we are talking publicly about a very successful project. So Allina Health is a mid-sized healthcare system nonprofit based in Minneapolis, Minnesota. We have 12 hospitals, 90 clinics, and have all the specialty care. We have about 27,000 employees. And our CEO is named Lisa Shannon. And what she will always say is she'll say, you know what our most important asset is our people. So we take well-being of our employees quite seriously. We've worked really hard to try to figure out what are the barriers that are keeping our employees from using all the resources that we have. And we worked really hard to have a wide array of resources. And people were getting kind of confused. Do I go to this website? Do I call this number? And then they would end up, frustrated, maybe not getting the support that they needed. And so that's where the idea for this project came. But we didn't have the tools. We didn't have the tools to really monitor and track and document some of the work that we wanted to do. So I just wanted to frame up that's who we are. We're a great healthcare organization. We're highly committed to our employees. And I think Ann is going to talk a little bit about what we have called the Well-Being Navigator.
Yeah, thank you so much for framing that up. That's great. So yeah, we want to give you a high-level overview of kind of, the why of what we developed and then the what. So I think if my slides are pulled up. Perfect. So again, what were we trying to solve? So a survey completed by our Allina benefits team revealed that employees reported their highest stressors included work, money, health, and children. And employees also reported that they felt that Allina had a lot of well-being resources. However, only a small percentage felt that the resources were meeting their needs. And we were also noticing that they weren't accessing some of those resources that we had. Next slide, please. Employees just didn't know where to start. And they also wanted to keep their request confidential. Many struggled with how vulnerable can I be when asking for help if it's through my employer. Next slide, please. So in collaboration with our benefits team, our mental health service line, and care management, we developed the wellbeing navigation team to really support employees and their household members navigating and accessing resources that supported them. We knew that we needed a documentation system that was outside of the medical record that we currently use for other services. Therefore, we worked with ViTelNet. Next slide, please. So how does it work? We have a wellbeing navigation line. It is staffed by Allina staff. So we have 2 navigation care guides and 1 social worker. There's a call-in line that employees and any member of their household can use to get support. We have had calls ranging from needing help finding childcare, accessing doula support, all the way to needing financial assistance to avoid eviction, or looking for that resource for grief and loss support after a family member passed. The calls are answered by our wellbeing care guides and escalated to social work if their need has a more psychosocial complexity. Support is provided to our employees both in real time and then also through their ViTelNet portal. We schedule a follow-up in ViTelNet and with our employee, and to assure that they were able to access the resources and that the resources met their needs. All of that documentation occurs in our ViTelNet system. Next slide, please. So who delivers the navigation support? Like I said, we have 2 care guides and 1 social worker. We also connect to our mental health consultants. So they provide EAP support to our employees and their household members. And then we also partner with our provider wellbeing program. And that's the program that Dr. Unsolvable is going to talk a little bit more about today. Next slide, please. So what are the outcomes? Next slide. So we rolled out our program in a pilot phase in January 2024 with just a select few Allina sites participating. This allowed us to work out kinks both in our standard work and then also in how we needed ViTelNet to operate for our documentation. In March of 2024, we launched system-wide. And so last year we had 626 calls with our highest volume of calls in October. Next slide, please. Then you can see here that most calls are for that emotional well-being. And then our second highest call-in reason is for financial resources and support. Most of our callers are our employees calling in, and just a small percentage being partners or dependents of the employee. And so, and we have, what was I going to say? Oh, and then the age, sorry, the age is there too. So 30% of the callers are between ages 36 and 45. And one of the things that we did learn a lot about is as we've promoted the program to our care team members, the ability to guarantee that the information that they share with our team is confidential and not included in their medical record has been a true key to this program's success. I'm going to kick it back over to provider well-being then.
So, Anne, before we do, a quick question as we look through this.
Yep.
You mentioned that people enjoy that it's not saved within your EHR. How is it being received by the team? Is this easier to go through than before? Because you mentioned that things were hard to navigate.
Yeah, I think, like I said, a lot of times that people just didn't know where to start. And so we're able to kind of guide them through that. And so they can call in and know that if they're asking for support for something, it's not going to end up in their medical record. It feels very separate and like safe for the employee to really truly say, here's what I'm struggling with, and can you help me navigate the resources? So I know that Allina has EAP support, but before, when I tried to utilize it, I just got a list of providers. I couldn't navigate that. Now we can truly use our system and navigate them to that mental health support, schedule that appointment within ViTelNet, and then they can have that visit occur.
Excellent. So are we moving on to Dr. Lardazabal? Yes.
Yes.
Excellent.
Great, thanks, Anne. One of the pleasures of having the Center for Wellbeing is we get to get the hands off from Anne's team. So again, one very, I would say, special and important group of employees is the providers. So here at Allina Health, again, we have about 27,000 employees. We have about 4,000 physicians and advanced practice professionals that are on our medical staff here at Allina. So how do we provide them that same level of care? And it's really important. So if you just want to maybe hop onto the first slide. So what we did, and this actually came out during the time of the pandemic, we recognized the stress, the strain, the burnout that our providers were having. So we created the Center for Provider Wellbeing. Next slide. And there are many reasons to do this. One of the reasons is it's the right thing for providers. Burnout has been increasing over the past 10 years, certainly with the COVID pandemic, and so many other burdens in terms of documentation, regulatory, that it's really affecting our workforce, and it's a precious resource. We know there's going to be a workforce shortage coming. So how do we keep people here? How do we prevent turnover? The financial cost of turnovers for employees, especially physicians, is quite high, and it can be, as you see on the slide, up to $500,000 per provider if you count in all the lost times of recruitment, the loss of revenue because you don't have a full-time provider. And not only is it financially important, it's so important for patient safety. So we know when providers are suffering from burnout, the risk of serious, significant safety errors increases. So it's quality of care. And of course, if we don't have early intervention in terms of well-being, what can happen is that providers that don't get care could end up having a clinical mental health diagnosis. And we know from the data that there's actually a higher rate of death by suicide in physicians and APPs than the general population. Next slide. So Dr. Woodland, I think, is going to talk about the structure of our center and why that confidentiality and privacy is so important.
Thank you, Dr. Lardazabal. So yeah, the Center for Provider Wellbeing is a part of a system-wide initiative for wellbeing at Allina Health. One thing I want to make very clear when I start this is that we are not a mental health clinic. We do provide some mental health services, but we also provide many other services and resources to our providers. And we also have representatives for the Center for Provider Wellbeing who are involved in system-wide changes and initiatives that occur in the system. So we're not only committed to the reduction of provider burnout, as Dr. Lardazabal was saying, it's a major issue, but we're really, and more importantly, focused on the promotion of professional fulfillment for our providers. We have a goal that we want every provider to be able to flourish as a whole person. So with that, we adopted the Stanford model for professional fulfillment, which, as you can see in this model, indicates that a culture of well-being, supportive structures and processes, and resilience tools promote professional fulfillment. And so with that, we identified 5 levels of intervention to support these domains, which are listed here, but include that education, anti-stigma culture work, peer support, direct care, system approaches, and leader development. Next slide. So as one can imagine, there are many barriers that prevent people from seeking support, and that's especially true for providers. Mental health stigma being a very significant barrier that prevents providers from reaching out for support. So the Center for Provider Wellbeing implemented various tactics to break down these barriers, which include presentations for new providers, letting them know that we exist, what we offer, and to kind of remove that barrier, that stigma of not knowing about us. We also worked with our legal and risk team to implement an opt out model, which basically means that we're given referrals for anybody that's going through any kind of legal situation or following an adverse event. We're given their information. We reach out to them to also remove that barrier of initiating the contact. As well as then a campaign that it's okay to not be okay and to change that stigma with mental health to really focus on that. And a big one is the development with ViTelNet, a safe, discrete, and confidential separate medical record system to keep our records for EAP and coaching services. Next slide. So the Center for Provider Wellbeing offers virtual and in-person resources to providers at Allina Health. These include confidential psychology, psychiatry, and substance use care, as well as confidential EAP and coaching services. In 2024, we had 70 connections initiated to the Center for Provider Wellbeing. I want to highlight that 2024 was really the launch, like the biggest launch of provider wellbeing. We had the opening of our space and really started to be able to provide these services. So we saw a steady ramp up of our initiated contacts and services that were being sought. So of these 70 connections, 35 engaged in EAP, 7 engaged in psychology, psychiatry, or substance use care, and the rest were provided resources like what Anne had mentioned in her presentation, as well as referrals to other partnerships or services that we have, including the Penny George Institute for Health and Healing and our Fidelity partners for financial services as well. And of note, in the first month here of 2025, we have seen a significantly higher amount of connections and initiations from providers, much higher than what we saw in January, February, and March combined of 2024. So we're very excited that people are hearing about us and are reaching out.
So Dr. Woodland-Laney, what do you
Yes.
think is the reason for the increase this year? Is it just the marketing internally, or what other things could there be?
I think it's multiple factors. I think it's that anti-stigma work that we're doing, the marketing of getting out, talking to the different providers, letting them know that we exist. And I think really that strong connection we have with Anne's team of the Wellbeing Navigation and getting referrals that way when there's providers that are reaching out to that service. All right, and next slide. And I think this will hand back to Dr. Lardizabal to kind of wrap up. Oh, I think you're still on mute, Mary Beth.
Sorry, I had dogs barking in the background, so I was going to save you from that. But it is just the beginning. I think we can't overemphasize the stigma and what I call the culture of medicine. It's so hard for providers to say that they need help. There's a lot of kind of an expectation that they're supposed to not need help. They're supposed to be perfect. So to get them to let down that barrier is a work in progress. But I hope, because they're having such good experiences and they are assured of confidentiality, it makes it that much easier for them to take that first step. So this is just our contact information. We have a confidential voicemail. Only the people that work at the center take those messages, so the provider knows that it's not going to, a general clinic or anything like that. And there's also a confidential email for them to contact us as well. So we're very excited that our healthcare system was so supportive of such a structure and that they were open to the innovation. I will say that prior to ViTelNet, we used a very, I don't want to say primitive documentation system, but it was not user friendly, and it was difficult for us to, to easily navigate and track things the way we can now. So it's been a great improvement. So I'm very grateful for that.
So a quick question for you both. You mentioned the campaign of "It's okay to not be okay." How are you getting that message out to the providers within Allina Health?
Well, I'll just say a little bit, and then Dr. Woodland can. One of the things that we thought was most important is that we needed to have what we say about our centers. It's by providers for providers, and from the very onset of the center, we established that we wanted to have 30 providers that were well-being leads that got paid to do the work of well-being, so it would not affect their income. They wouldn't have to work extra hours. So they are spreading the word. They're doing, one-on-one. We say, culture changes by one person, one conversation at a time. So they're talking to providers. They're getting in front of their teams and their departments. And I know Dr. Woodland does a ton of work meeting with groups of providers. And we also do new provider orientations, where the first thing they hear is that, hey, we have this and it's okay. So it plants the seed, and they might not need it at that moment when they're getting oriented their first week of employment, but they know we're here. Just like the well-being navigators, they know we're available. And I'll just say, physicians don't usually do anything till like, oh, now I need it and I need it now, because probably like the rest of us, right? They tend to put things off, or they think it's going to get better. But Dr. Woodland, would you have anything you want to add?
I think just implementing various initiatives that promotes discussion about mental health, about stress and how we deal with it. We've launched a series of Caring with Coffees that really focus on how to manage stress of various kinds. We started with how to manage stress over the holidays, because that tends to be a very stressful time for most people in the world. And I would say probably a little bit more for people working in healthcare, just as people are getting in before the end of the year and various things like that. So just promoting the ability and willingness to talk about stress and acknowledge that maybe I'm not okay, and maybe it's okay if I talk about some of this or utilize some of these services and resources available.
I'll also just bring up that Dr. Woodland started a provider podcast, which is, how do you get information now? You do it kind of in bite-sized pieces. You're not going to sit for an hour probably and listen to a lecture, but you can listen to a podcast. And so the well-being leads that we have all have this really interesting skills and expertise in different areas of well-being. And so we had created a podcast series, and it was actually open to all employees, but especially our providers, that they could learn about sleep, how to improve their sleep. They could learn about meditation. They could learn about exercise, things that we all can benefit from, because really it's about prevention and being, as Heidi would say, professionally fulfilled, which means that we have a balanced life, that we have important things besides work.
That makes a lot of sense. And it sounds like, from your perspective, the prevention side kind of goes hand in hand with the technology side that ViTelNet and the group has been able to provide. So it's like, hey, we're trying to do all the prevention things that we can, but we know that you still need help. We're not alone in this, and you have that messaging to kind of, hey, here's a technology to help you with the overall messaging.
Yeah, exactly. And it does not need to be in our electronic medical record. And you know what? If it was, it would be a barrier. People would not come to our center because they would be afraid about, even if we're talking about well-being, it's in your medical record. And I don't know if people know this, but there's a lot of work about trying to change the way doctors are licensed in the state, how they have to credential for insurance, because in many states there's still very discriminatory language that will say, like, have you ever sought mental health care? And you have to literally put that on your medical license application, and they worry that would be a barrier. So if I decided I wanted to go see Dr. Woodland because I'd lost my parent or something, if I just went for one visit, I would have to put that on my medical application in some states for the rest of my life. That's discrimination. It actually goes against the American with Disabilities Act. So we have been working to change that. And Allina, we have changed all of our documentation, credentialing to be different, to not put that on our application. So that's the type of barrier we're talking about. That is one very legitimate reason why doctors are afraid to have any information in an electronic medical record that is open to the rest of the system. So having a separate record for that early interventions of coaching and EAP is really essential.
I didn't realize that could be put on a doctor's license that would follow him or her wherever they go. So that's learn something new every day, I guess.
Yeah.
So thank you, Anne, Dr. Lardizabal, Dr. Woodland-Liney, for sharing. I really appreciate the things that I've learned. Even I know we've talked about this a couple times even before then. It seems like every time we're meeting, I learn something new. And for you guys, while I was starting to prepare for this webinar and some of the things that we were going to talk about, I did find the initial email that was sent to us about what you guys were looking for. So I do want to read that because it kind of shows of where we started to where we are now, right? So I'll quote this. So this is from one of the representatives from Allina Health. I was recently asked whether we would have the ability to use video, now Enghouse video, as a standalone system outside of our EHR for on-demand visits, which mimics the on-demand functionality within our EHR. The idea would be that someone could use a web-based front door to get into a video queue for a virtual visit. Some nice to have patient features would be display and communicate estimated wait time. Patient can choose to wait in the queue or be notified via email or text when a provider was available. And then on the provider side, there would be some kind of notification that a patient was waiting in the queue, and the queue of patients would be available for providers to accept and order. Do you know of anyone doing something like this? And does it sound like something that would be possible? So, now I can say, yes, it's possible, right? And I think it's really amazing that we started with these basic requirements, and now we're talking about all the things that you're doing and helping with the providers today. So Jeff, so after this, I reached out to Jeff and went, do we have any options for this? So Jeff, do you remember those initial conversations?
Absolutely. I mean, I think obviously, Rob, we work not only with healthcare customers, but others, and it's the evolving use cases that we see for telepresence as a whole. And each time I think, okay, I know all the different permutations. We see something else evolve. My main goal is to make sure that they're optimizing the infrastructure that they've already got in place. What I really appreciated is anytime you have a customer with such a worthwhile project, but it's also coming not looking for, hey, this is the preset thing and I want to have one of those. This is what I need. You help get me there. And there wasn't anything off the shelf that we had, but we knew we had the requisite pieces. And what we'll be talking about here as we go through is that it was very siloed, but in a very good way. Complex things do sometimes need to be siloed, but it's a matter of bringing that expertise together. So from an Enghouse video perspective, we were the infrastructure. We were being leveraged for a number of other telehealth utilizations and workflows, providing that stable concrete core that was customizable. Rob, you came in with thought leadership direction and a lot of the support components you're already doing. And then the secret sauce we had is Mark coming in that really had those key elements with regards to the privacy and the documentation and the integration. So having not only those various silos that we could pull together, having a customer that trusted us to help put something forward to them, and we're focused more on the outcomes versus what the actual set package was. I think it was really what made it an interesting project from our point of view, and the three groups being able to each have a focused support mechanism. Because one thing is to build it, And then it's how do you make it run and work? Because obviously once it's up and available, you want to make sure it's available. This is important things that obviously we want to make sure are consistent and available. Mark, I'm not sure if you had the same sense at the start of this. Again, I was super excited when you said, yeah, actually, I think we have something to talk about, guys.
Yeah, absolutely. Like you said, it's a great project, great initiative, innovative. Love to work with passionate people who are looking to make a difference. And yeah, the starting point is not where we ended. Right. It was a full journey that you know, you don't, our CMO has a saying that he likes to repeat over and over, and that is, if you give me what I want, I'll tell you what I really want. And that's what happens when you're innovating, right? You don't know what the end point looks like yet. You just have an idea of what the outcome is that you want to enable. The path to get there isn't always as clear right up front. So having the flexibility and a team around you that can adapt to the needs that you have as you go through that learning process, I think is key, and I think that's what we experienced here.
Mark, I remember on one of the initial project calls, it happened twice through that initial process, and you'd love to see as an integrator, as a technology resource. I always like it when it happens. We had done the presentation and you had walked through the workflow and it was, hey, this is excellent. This is great. We'll move forward. It's too bad I couldn't do this. Well, actually, yeah, I can. Oh, anyway, there was a couple times where it was like, this is wonderful. Just too bad I couldn't do this. And we were able to do so. That you don't always get to do that, but that's where, again, keep refining so that we make sure at the end it's what's most functional and providing the most value.
100%.
So, Anne, Dr. ViTelNet, Dr. Lardazabal, how was it working with Mark's team? So I know Mark's team is very good at healthcare workflows. They, within ViTelNet, I've seen a lot of different things they've done, such as telestroke workflows, connecting with multiple EHRs, etc. What's your take on working with Mark and going through the process to get from the basic requirements to where we work today?
Yeah, I think, it was really great working with Mark and his team. I think we threw a lot of different curveballs at him. We would start with like one thing and say, I think we want this. And then we would maybe put that into practice and be like, oh, actually, we don't want that. And they were so great in terms of like, okay, here's options and here's what we think that could look like. Because we were just not used to like developing a documentation system from the ground up for a program. And so I really enjoyed it. I felt like we were all best friends by the end of it because we had so many different meetings and touch points and just, real time problem solving too. Like when we launched, they were there to support us, right? So that launch day, we were in contact multiple times a day, just making sure like, are things working the way we thought they would? How are call volumes? And they really felt invested too, in terms of like, they want this program to succeed as much as Allina Health did. So it was great.
Yeah, I will say that, what is that? Too many cooks in the kitchen. Mark and company had the challenge of so many people at Allina, and maybe they all had a maybe different idea about what it should be, and then we didn't know what it could be or what it couldn't be, kind of on the technology side. So having to go through that, and I'll say, Mark, you were very kind through all that process, because it's a lot of work, and it confuses folks, and folks can get frustrated because we didn't really know, as Anne said, but it was really important to have such frequent communication in terms of check-ins and work groups. That I think that's what made it work, and that support during the go live, that was essential. So.
Yeah, I mean, I echo everything that they said, and I would just say I really appreciate just the willingness to have conversations about any ideas that we might come up with or any issues that we might be having. They were just so receptive and respectful in having those conversations with us about how we can problem solve or what we could do different.
No, thank you all. It's a partnership, and that's what we said from the get-go on it. and the leadership made a huge difference that you guys provided in kind of bringing the feedback into a common point, so it became, was manageable to to make it happen. So thank you all.
Yeah, and this is the partnerships that we're talking about. That's part of what IDS tries to do. We try to be our customer's best partner. And sometimes it's with us directly. Sometimes it's bringing in the right people with the right knowledge to do the right things at the right time. And I think, talking with Jeff and he and I going, hey, we really think Mark and his team would be the perfect fit for what Allina is trying to do. And then just making those connections and going, hey, here it is, and letting you all run with it and do the things that we need to do. And I think that also speaks to the flexibility of what the ViTelNet software could do for any organization out there, not just what we're talking about today, but for a lot of different applications, etc., where people go, I know I need this, but I don't know how to get to this because I just have this idea. And I think Mark and his team are very good of talking through where we're trying to go, what we're trying to do, and going, hey, I understand. Here's some thoughts, here's some ideas of how we can start moving the process forward.
Yeah, exactly to that point, Rob. The conversation here has been around this amazing program, but the bigger picture here is Allina was looking to innovate. And when you go to innovate, the tools aren't necessarily readily available off the shelf to support your vision of what you want to do. At which point you've got some options, right? The first option, you can choose to go ahead and compromise on the vision and make it work with whatever tools are available. You can go ahead and build your own, or you can work with somebody who's got a flexible platform that can adapt to the needs and such. If you go the first path and you compromise, what you usually end up with is pretty clunky workflow, right? And you end up adding more burden to the providers and that sort of stuff. The second option, you can get exactly what you want because you're having it built. The challenge then is maintaining it after it's built, right? And there's an ongoing expense associated with that. The third option of working with somebody who's got a flexible platform that can configure to the needs has kind of the best of both worlds, right? Yes, it's going to take a couple more weeks to implement than if you used off the shelf stuff and kludge together a workflow. But on the other side of that, as we talked about, there's a learning journey that goes on here through the innovation process, and you need to be able to be flexible and continue to manipulate the solution in order to meet what the provider workflows are. So that's pretty much what went through here, and that's what we got to talk about today.
And thank you. And I think we're kind of wrapping towards the questions that people have. So I'm pulling those up right now. Let's see. First one I have. So when I'm innovating, I find that I learn from experience and need to adapt as I go. Did Allina have a similar experience? And if so, how did you manage the changes with your technology partners and clinical staff? I don't know who would like to take that one from the Allina team.
Yeah, I think we definitely had changes as we went along. I mean, even from that initial email that you read to how the program is now laid out, we made a lot of changes in terms of, one, what does best practice and best support look like? And then, two, how can ViTelNet help us accomplish that? And so we made a lot of changes. We're still innovating too. We recently added an online option through ViTelNet, which they helped us figure that out, right? We came to them with this, like, we need some way for, our care team members to be able to put in a request online, and they helped us do that. So it's kind of just an ongoing, partnership that's great, especially as the program continues to develop.
Yeah, I mean, there were a lot of things we didn't know at the beginning, like how are we going to communicate the Center for Wellbeing and the Wellbeing Navigator? Should we be able to read each other's notes, or was there the need for privacy in some of the content there? There was discussions about how much we would be using the virtual platform in terms of the referrals to our mental health consultants. So all these things, and then about the billing piece, billing for our EAP charges, how would that work? Would that be inside or outside of ViTelNet? So as we really kind of work through, there are more and more knots that we had to untangle in terms of that workflow. Of course, getting paid is important. So that piece took a little while because that was starting to interface with another system altogether. So.
Yeah, I'm assuming it's the technology and the program is still growing, expanding, and changing too, right? So are you still going through different adjustments, tweaks, and fixes as needed?
Yeah, absolutely. I think, you read that kind of virtual piece. That was the first email. So the virtual on-demand piece, how do we grow that? Who do we serve with that? That's a question that Allina is talking about. If you think about how the world has changed in terms of virtual work, I think we'll probably get some, hopefully, finality from the government about what services will be paid for virtual care. And then I think, I think there'll be more and more opportunities. And part of the reason we wanted to do that as a healthcare system is that we span the state of Minnesota and part of Wisconsin. So how do we reach people, what we call greater Minnesota, folks that, maybe work, hundreds of miles away from our metro, but they might work in one of our facilities because we actually have regional centers all throughout the state. So just thinking about, as we grow, can this grow with us? And that's the piece that will, we might want to be doing some tweaking in the future after we've been doing this for a little while.
So here's another one. Are you able to use the same instance of video infrastructure for the employee assistant web application as you do for your other telehealth programs? And Jeff, I saw you unmute, so I'll let you get.
I unmuted right away. Yes, absolutely. As I'd said it right off the top, I mean, that really for us is providing that core infrastructure, that highway. You can drive a truck, you can drive a sports car, you can drive an ambulance. Having that flexibility is very, very important, and we certainly do allow for a whole series of different integrations for those various workflows. The good thing from our side is that there was no additional elements from us. So the same infrastructure they're already paying for inpatient and outpatient activities that they're doing, they can leverage those same channels securely for this workflow, and it just adds to the overall value. So again, the Allina being able to utilize the pipes and in the instances that they have to the fullest capability just adds to the overall value of what they're getting for that piece.
And I think there was comfort there too for employees that maybe have already used that video platform for a different visit, like through the other EHR, coming into navigation and meeting then with, utilizing their EAP and knowing it's the same. Oh, I know that platform, like that. There was comfort there. So that was helpful.
Thanks. I know that's absolutely right. Is that consistency of the interface as you go through just helps breed adoption as well, I think, in the new services.
And the APIs that are available enables us to have it embedded inside the web workflow. But in Allina's case, as Ann was saying, folks already had the Video Connect client installed on their machines and were very comfortable with it. So the provider still wanted to use the Connect client, while the beneficiaries were coming in through web browser. Made it simple for them, and that was a nice blend, leveraging again the technology that was already in place.
Okay, here's another one. So the service was being offered to providers, but there was mention of spouses and children using it too. Was that on purpose or accidental? were you offering that to spouses as well?
Yeah, so the difference between, so the navigation well-being is open to all our employees and their household members, so, you know, partners and dependents, and then providers, and correct me if I'm wrong, is open to just the providers that are actually employed with Allina Health.
Okay. So that's why we were seeing from your side
Yeah.
the spouses too, and okay, makes
Yeah,
sense.
so we're providing support across the continuum and across our whole, you know, Allina Health family, which is awesome. And then providers have that, you know, specific benefit through provider well-being.
Right. And we might actually say to our providers, huh, your spouse might benefit, and you actually have that benefit as a beneficiary. So maybe we could connect you to the well-being navigators for their families, which is great.
Next question. How did you manage contracting and support with these different technology partners involved? So I'll kind of start with this, and anybody else can chime in if they want to. So IDS is an integrator, if you will. What we do is we try to bring the best people together to help support our customers. I mentioned before being our customer's best partner. And with that being said, we make the connections. We go through and vet the different vendors that the hospital systems may be looking at, or health system may be looking at, and bring them forward. So all the contracting actually goes through IDS. You know, we sign BAAs with the health system. I have a BAA with Mark and his team. I have a BAA with Jeff and his team to make sure that things are secure in that aspect. All contracting goes through us, and the things that need to happen to make sure that the technology legally is able to do the things it needs to do in that aspect. And then on the backside, we already talked about how IDS was the partner that hosts and manages the in-house video platform that they're using today. And part of that hosting and management of the platform is we're their first call. So when something happens, you know, heaven forbid it does, but if something happens, we're there helping to get services back up and running, or help with connectivity, or a camera's not working, we're there to try to help troubleshoot why it's not working. And as we introduce these other partners like Mark and his team, the need for that capability was still there. And so we are still the first call for the team as things happen, and we'll try to do our initial troubleshooting, and then we'll triage with Mark as needed, or Jeff and his team as needed, if there's things that we cannot have. But we give that initial front view of a single phone number, kind of like what you all shared, is we have that single phone number to call for support, for technical support, so that, and then we will handle the adding whoever we need to add to help finalize the support that's needed. Oh, this is an interesting one. Is Allina willing to offer its EAP services to other health systems and employers?
That is an interesting one, Rob. We've talked about that, and that is a part of our future vision, particularly, and I can speak for the Center for Provider Wellbeing. So right now, we're a resource for our own employed and independent physicians that are on medical staff at an Allina facility, but we would really like to be available as a resource for all docs, like certainly within our own, like Metro, we have, you know, many healthcare systems, and it's even a bigger level of protection and safety when someone can go outside their healthcare system for care. And part of the virtual platform also makes it possible for us to reach physicians that are, you know, could be, you know, in another state across the country. I mean, so we could really be thinking about how we could be a much larger research. Part of the thing that we're doing actually at the center is we're doing some research on provider well-being. What are the best interventions to use? So as we think about that type of work, we would really like to spread what we're learning to other institutions. And Anne, you might say a little bit about the Wellbeing Navigator service.
Yeah, I think it's the same. We really truly feel like this is the best support for patients, the model that, or employees that we have built, and we would love to be able to spread this to other employers and that type of thing.
Okay. I am not seeing any other questions. Does the panel have any other questions for each other? I mean, we're here. Anything you want to share or question? No. Okay. So with that being said, I do want to say thank you all for joining us today and being a part of this engaging and insightful discussion. We hope you found value in learning about how innovative solutions like the one at Allina Health can drive meaningful outcomes and inspire new approaches in your own organizations. A big thank you to our panelists for sharing their expertise and experiences here today. Their collaboration and insights truly highlight what's possible when forward-thinking partners come together to solve complex problems. If you have any additional questions or would like to explore how we can help you achieve similar success, please don't hesitate to reach out to us directly. A recording of today's webinar will also be shared with all attendees soon, so keep an eye on your inbox for that. And on behalf of Allina Health, ViTelNet, Enghouse Video, and IDS, thank you once again for spending your time with us today. We look forward to continuing the conversation and supporting you on your journey towards innovation and success. Take care and have a wonderful rest of your day.